So we're going to pivot, which is the Silicon Valley word, to talk about value for a second, and we'll talk a little bit about some of the international comparisons that you've heard already about the shift from volume to value, and you will certainly hear more from Joe and I in a second. But I think it's important to stress we need to work both on the numerator and denominator of value. It's not just reducing cost, it's also improving quality. And the other issue we want to touch on is transparency. And HFMA has used a very useful framing of this, which is your sort of value equation, Joe. So say a little bit about how you see value.
Well, it's interesting, this equation, we put it together at the beginning of our value project, and as you know, we've had a series of value project reports. Carrie mentioned we have 3 issued this year, one right at ANI here, the most recent one on cost reconfiguration. That value work carries on. Sometimes value is one of those buzzwords in our industry, and when something becomes a buzzword, it starts to lose some of its meaning. We just use it all the time. The thing that we did in our value project is we started to look at value from a consumer perspective, whoever that consumer is, the patient, the purchaser, but looking at value from there as opposed to just looking, for example, like in our recent cost reconfiguration report, we didn't just look at the cost of being a provider, but what does that mean to the end user? And so I think that's a different view of value and something that's important to keep in mind as we think about it.